We will now begin your PAPR training. PAPRs are worn by employees that cannot be fitted to an N95 or those involved in performing a high-hazard procedure on a patient with an airborne transmissible disease. Please see the blue card for a list of high-hazard procedures. Please refer to the Airborne Transmissible Disease Policy and your instructor for further questions. PAPRs and hoods are located in the emergency department, ICUs, radiology, respiratory therapy, and other departments as designated, and central supply. The parts of the PAPR are the battery and the battery charger, the motor blower, the breathing tube, and the hood. Notice that we carry two hoods, the standard hood and the surgical hood. We will discuss the two hoods at the end of this video. Step 1. Inspect the equipment. Check the integrity of the equipment for any obvious cracks, holes, damage, etc. If you find the equipment to be unacceptable, tag it and take it out of service. Step 2. Testing the battery. Test the battery by pressing the white button labeled Test and hold it down. When all 5 bars are lit up, the battery is fully charged. When it gets down to 2 bars, do not use it. Recharge it and select another battery. Always keep the batteries on the chargers when not in use. Step 3. Attach the battery. Line up the 4 gold prongs together and press into place. You should hear it snap. Step 4. Testing the air filter. Make sure there is a filter in place. It is purple and visible through the window. We will now conduct a flow test prior to every time we use it. Insert the airflow indicator into the outlet on the motor blower unit. Turn on the unit and let it run for about a minute. With the airflow indicator in the vertical position, ensure that the bottom of the red floating ball rests at or above the minimum flow mark indicated by the black horizontal line. If it fails, take it out of service. To turn it off the device, you must press and hold the power button down for a few seconds. This is a safety feature so that you don't accidentally bump the power button off while doing patient care. Step 5. Attaching the breathing tube. Attach the end of the tube with the 2 silver prongs into the motor blower. Twist it so that it locks. Attach the end of the tube with the blue ring onto the back of the hood. Remove the plastic protective film from the face shield so that you can see. Step 6. Put on the PAPR. Place the PAPR motor onto your waist and secure with the strap. Turn on the motor. Now place the hood over your head. The gray headband rests on your forehead. The elastic band goes around your face. Move the motor to your side or back to be out of your way. Remove your hood and turn off equipment. Hood reuse will be limited to 1 shift and only for use with the care of a single patient. Individual hoods shall be dedicated to a single employee and shall not be shared between employees. Damaged or visibly soiled hoods should be discarded. Hoods to be reused shall be stored in a bag labeled with the employee's name and room number if the anteroom serves 2 or more patients. Bags with hoods shall be stored in the anteroom or clean area, never with personal belongings. Wipe down the equipment with the approved disinfection wipes for that room. Allow to air dry before placing in storage. Do not open the filter housing. Don't forget to put your battery back on the charger.